हा दे आजींना. आजी
हा बोला.
कशा आहो?
बरं आहे की.
बर, काय त्रास होतोय?
डोसकं दुखत.
बर, सारखं सारखं दुखतंय का कधी मध्ये दुखतंय?
आपण मात्या राहत.
बर
हा.
बर, डोसकं दुखल्यावर चक्कर येते का अशीच चक्कर येते?
अशी येते.
बर
करत.
बर, डोळ्याला अंधार येते का तवा?
येते ना थोडी.
बर, चलताना धाप लागते का?
जरा लागते रुपयातलं चाराने.
रुपयातले 4 आणे लागते. बर बर बर, पहिलं काय डीपी फिपी होता असं सांगितलं होतं का कोणी?
नाही नाही, सरकारी दवाखान्यातच कधी नाहीच म्हणले.
बर बर बर, ठीक आहे. कुठली गोळी खाताव का आता?
नाही ना.
बर, दमा ही काय आहे का? दम्यासारखा काय आजार आहे का?
काही नाही तसलं.
तसलं बी काही नाही. बर 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 बर, चालतंय. आता आपला थोडासा डीपी वाढलाय. ह्या बाजूच्या ताईला सांगतो मी एक औषध द्यायला. ती गोळी खायची दररोज. सकाळी आपलं काहीतरी उपाशी पोटी नाही घ्यायची, काहीतरी खाऊन घ्यायची.
बर
बाकी काळजीचं नाही काही.
बर,
चालतंय. शुभांगी, त्यांना हे दे, अॅम्लोडिपिन 2.5 mg ठेव फक्त, आणि 15 दिवसानं फॉलोअप घे. Okay. If you have seen this patient, no, I mean she is quite old age lady, 80 years of lady. She looks a bit more than that. Basically, she has hypertension, 148 by 102. Her diastolic is a bit high, and she is giving history of dyspnea, giddiness, and headache. Headache is intermittent, giddiness is also intermittent, and dyspnea on walking. So these are typical symptoms of having her hypertension, and this particular BP is causing her, making her symptomatic. So I mean, we'll not go very aggressive for her as such, and we'll give her amlodipine very low dose and check out for a couple of weeks that how it behaves and how it goes on, and accordingly we can modify her medications on subsequent visits. So on 15th day we'll take a follow-up and watch out for her symptomatic improvements, and later for anything else to be added or not. So this way the patient should be managed, and one more interesting things I would like to show you is, look at her WHO ISS score. Though her age is 80, still her WHO ISS score is not very high. Probably this is a bit of having an surprising things, and we do generally in our areas, particularly this peripheral areas, rural areas, we still find a lot of octogenarians who have their blood pressures, who have their blood sugars, or who have their cardiac health absolutely unremarkable. There are huge number of patients, and we previously observed many in our during screenings during May measurement months, that we did have many octogenarians who are more than even 90 years of age, but still they were not having hypertension or any comorbidity. So this way I think we do have a good role of telemedicine in managing octogenarians as well, that these patients generally don't walk up to hospitals or distant distances. Secondly, they are not as such neglected, but because they may have a borderline symptoms which may not warrant their relatives or colleagues or to take them to the hospitals. So that is one of the neglection, indirect neglection, or I mean, it's not an intention, but unintentionally this neglection can happen at their homes. So we should the telemedicine should play a role in treating the octogenarians in this way, by monitoring their blood pressure and sugar levels, by making point of care investigations at their doorsteps. That may change a lot of scenario and reduce down the morbidities in such age. Thank you. This is Dr. Arun More, founder and clinical cardiologist of MH Clinic and Rural Health Progress Trust. Thank you.